pressure that's at the base of the skull, where it always feels like there's fluid or buildup or tension, can indicate problems with the cranial cervical junction. It doesn't just have to be that knot that's on one side that never seems to go away. It can be pressure. You can have issues with the blood flow or the cerebral spinal fluid not coming in and out of the brain properly. Not only can it change pressure gradients, but it can change the physiology of the brain. If the blood's not bringing the right nutrients and oxygen to the brain, the cerebral spinal fluid acts as the lymphatic system to clear out the waste. Think of it as the garbage removal system of the brain. We'll see it in Chiari malformations where that fluid is not flowing properly. And many of these things can be linked back to problems with the cranial cervical junction. And they don't happen in a vacuum. In many cases, what we'll find is you have anxiety or fatigue or brain fog or maybe gut issues because the vagus nerve can be affected as well. And when this happens, it throws your autonomic nervous system off. But none of these things will traditionally show up on your blood work, your CT scans, or your MRIs. In many cases, it's more of a clinical diagnosis in the absence of some of the other pathological symptoms that we could see. So if you're having this combination, and it's not just the knot, it could be headaches, it could be migraines, it could be dizziness or vertigo, and you're having these combinations of issues, but you can't really figure out what's going on. The mainstream system hasn't been of much help. They say it's stress or anxiety or here's some meds to try to manage the symptoms, but they never really get to the root cause of the problem. And so this is what we specialize in by correcting those issues at the craniocervical junction. In layman's terms, it's very simple. We are just trying to get the body to function normally again. And when it does, the problems should resolve or go away if they're related. And there obviously are other problems that could be totally unrelated. But if it's coming from that misalignment in that craniocervical junction area, then these things should improve. So leave us a comment below if you would like more information about how we help these types of cases.